Are you getting ready to enroll in Medicare? You've probably heard lots of letters tossed about for many different parts and plans, and you need to know what it all means before it's time to enroll. Hi, my name is Sarah, and I'm here today with iHealthBrokers to discuss Medicare Parts A, B, C, and D. As you approach 65, you're probably thinking about Medicare and what it means for your health insurance. If you've been insured through an employer in the past, your options have been limited, making choosing much easier. With Medicare comes new choices, which is great, but not all of these choices may be right for you. In today's video, we're going to discuss Medicare Parts A and B, also known as Original Medicare, Medicare Part C, also known as Medicare Advantage, and Medicare Part D, which is your prescription drug coverage. Now, with all these different types of Medicare and different parts, there are many different enrollment periods and there are late penalties. That being said, you don't ever want to rush into a plan without doing your research. So if you have any questions, we really do recommend that you work with a licensed broker. A broker is a third party who works on your behalf, and of course they do so at no charge. You will not be charged extra for working with a broker. In fact, you might end up paying less. If you'd like any help, you can reach us at iHealthBrokers at 888-410-0344. We are licensed nationwide, so no matter where you are, we can help. And like I said, we do so at no charge. All right, let's get started with Medicare Part A. Medicare Part A is your hospital insurance. Generally speaking, it helps to cover things like inpatient procedures in a hospital, nursing facility care, nursing home care, home health care, and hospice. Now, it helps to cover most of the costs, but you are still responsible for approximately 20% in hospitals that accept Medicare. That's why a lot of people look towards Medigap plans to help cover these gaps in coverage, also known as Medicare supplement plans. We're not going to talk about those today in this video, but you can check out one of our other videos to learn all about Medicare supplement plans. Many people also look towards Medicare Advantage to help cover these costs. That's also known as Medicare Part C, and we'll touch upon that momentarily. Now, the good news is that even though you are responsible for a portion of these costs for the procedures, generally speaking, most people are not charged on a monthly basis for Medicare Part A, meaning there are no monthly premiums. Most people plan on enrolling in Medicare after retirement. Let's go over the exact criteria for eligibility. You are eligible for Medicare benefits if you are over 65 and a U.S. citizen, or you are over 65 and a permanent legal resident who has lived in the United States for at least 5 years. You're eligible if you're receiving Social Security or railroad retirement benefits, or have worked long enough, which would be 40 quarters, to be eligible for benefits even if you're not collecting them just yet. You're also eligible if you're over 65 and you or your spouse is a government employee or retiree who has not paid into Social Security, but who has paid into Medicare payroll taxes while working, meaning a Medicare covered job. You may also be eligible if you're under 65. Now, you're eligible if you're under 65 if you have received Social Security benefits for at least 24 months. These months don't have to be consecutive, so it's okay if there are breaks in between, but it has to be at least 24 months total. Additionally, you're eligible if you're under 65 and you have ALS, or if you have end-stage renal disease. For many people, enrollment in Medicare Part A is automatic. If you're receiving Social Security benefits, you'll be automatically enrolled and you don't have to do a thing. You'll receive your card in the mail 3 months before you turn 65, and that's it. The same thing applies if you're becoming eligible for Medicare through disability. Now, you can choose to defer Medicare Part A if you'd like. However, for most people, there are no monthly premiums associated with Medicare Part A, so it's not usually something that we'd recommend. However, if you feel that it would be a good idea for you, we recommend contacting a broker to discuss your unique situation. If you're not automatically enrolled in Medicare Part A, you have 3 opportunities to do so. You can do so during your individual open enrollment period, during a special enrollment period, should you qualify, or during the general enrollment period. Now, your individual open enrollment period is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. Now, you may qualify for a special enrollment period if you've maintained creditable coverage with no gaps elsewhere. Generally speaking, a special enrollment period is triggered by a qualifying life event, and this includes the termination of health insurance. So if you're working past 65 and you're getting health insurance through your employer, you're most likely eligible for a special enrollment period. Finally, there's the general enrollment period. Now, this is every year from January 1st to March 31st, and then your coverage begins July 1st. If you do apply outside of your individual enrollment period or a special enrollment period, you may be charged a late penalty. Now, this is why a lot of people don't choose to defer Medicare Part A because, like I said, usually no monthly premiums. However, if you wait too long, you can be charged a late penalty for no reason. A lot of people do, however, choose to defer Medicare Part B. So for many people, if not most people, Medicare Part A has no monthly premium. However, if you're relying solely upon your employment for eligibility and you have not worked at least 40 quarters, you can pay a monthly premium and enroll in Medicare Part A. Currently, in 2020, that monthly premium is $458 or less, depending upon your specific circumstances. Now, if you continue to work, once you've reached those 40 quarters, those monthly premiums disappear. Medicare Part B is your outpatient insurance. It helps to cover things like doctor's visits, mental health services, outpatient surgery, ambulance services, medical equipment, durable medical equipment, things like wheelchairs and walkers, and limited prescription drugs. This is very important. This is not to be confused with Medicare Part D or Medicare Advantage. The limited prescription drugs that are covered by Medicare Part B are things that are administered to you, things like injections at a doctor's office, or chemo, or certain oral cancer medications. The criteria for eligibility and the enrollment time periods for Medicare Part B are exactly the same as Medicare Part A. However, unlike Medicare Part A, there is a premium, a monthly premium associated with Medicare Part B, and that monthly premium is dependent upon your income. That's why a lot of people choose to defer Medicare Part B if they're still working. So if you're maintaining creditable coverage outside of Medicare with no gaps, you may be eligible for a special enrollment period, which means you can defer Medicare Part B and not incur any late penalties. Now, with Medicare Part B, just like Medicare Part A, Medicare covers a portion of the cost, leaving you to cover the gap. That's why a lot of people look for a Medicare supplement plan or Medicare Advantage to help with those costs. Timing with Medicare Part B is very important. You only have a 6-month window after you enroll in Medicare Part B to enroll in a Medicare supplement plan with no medical underwriting. Now, you can enroll in a Medicare supplement plan year-round, whenever you want, but you only have that 6-month period after you enroll in Medicare Part B to do so without medical underwriting. Now, if you miss that 6-month window and you're subject to medical underwriting, then you can be denied based on your health. Additionally, if you are automatically enrolled in Medicare Part B and you wish to defer, you need to follow the instructions on the back of that card and send it back. Because if you keep the card, you keep Medicare Part B, which means you're going to be charged for it. Medicare Part C is also known as Medicare Advantage. Medicare Part C encapsulates the benefits of Medicare Parts A and B, which is original Medicare, and very often Medicare Part D as well, which is your prescription drug coverage. Medicare Part C helps to bridge the gaps of original Medicare and limit your out-of-pocket spending. And very often, Medicare Part C plans have no monthly premium. You just continue to pay for Medicare Part B. Also, Medicare Advantage plans usually offer benefits like dental, vision, hearing, and even gym memberships. And all these benefits can make them very appealing. Many people find themselves choosing between Medicare Advantage or Medicare Supplement plan. And is Medicare Advantage right for you? Honestly, it just depends. It depends on things like the doctors and hospitals that you wish to visit, your financial concerns, your health concerns, and even the state that you live in. These things all come into play when deciding if Medicare Advantage is the route you want to take. Medicare Advantage offers HMOs and PPOs, so it's probably going to feel pretty familiar to the type of coverage you've had in the past. Additionally, with Medicare Advantage, there's no medical underwriting, unlike certain Medicare supplement plans, so that means you can't be denied. If you want to learn more about Medicare Advantage versus Medicare supplement plans, just check out one of our other videos. Now, if you want to learn more about all the different Medicare Advantage plans offered, just log on to medicare.gov, that's medicare.gov, and access the Plan Finder. However, given that there are so many options, we really do recommend that if you're going to go with Medicare Advantage, you contact a licensed broker. The enrollment period for Medicare Part C is different than with Medicare Parts A and B. However, eligibility criteria is the same. So if you're eligible for Medicare Parts A and B, you're eligible for Medicare Part C. The enrollment periods with Medicare Part C are your individual open enrollment period, a special enrollment period if you qualify, and the annual enrollment period. Now, your individual open enrollment period with Medicare Part C is the same as with Medicare Parts A and B. That would be the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. Then there's also that special enrollment period if you qualify, and the annual enrollment period. With Medicare Part C, the annual enrollment period is every year, same time, from October 15th to December 7th. During this time, you can join a plan, drop a plan, switch a plan, and it's a very good idea to make sure that you review your benefits at this time, because those benefits with Medicare Advantage can change annually, so it's a good idea to review them with your broker. Medicare Part D is an important one. It's your prescription drug coverage. And without prescription drug coverage, your prescriptions can cost a lot. In fact, there's a name brand cholesterol medication that can cost as much as $1,700. Now, this is obviously an extreme. I just want to stress how important prescription drug coverage is. And without Medicare Part D or Medicare Advantage, there are really only a handful of prescriptions that are covered by original Medicare. Medicare Part D is also probably one of the most confusing parts of Medicare. Like Medicare Part C, it's offered by private carriers. However, it's regulated by Medicare. So companies can offer better benefits to compete for your business, but they have to meet certain criteria. With Medicare Part D, there are 4 stages. Stage 1 is the deductible. Now, this is a certain out-of-pocket max that you have to reach before your insurance kicks in. Now, some companies, some carriers may waive it or lower it, but you can only be charged a certain amount out of pocket before you move on to Stage 2. Stage 2 is the period of initial coverage. This is, like I said, when your insurance kicks in, for a lack of better words. At this point, you'll be charged co-pays for your prescription drugs. And the copay is dependent upon the tier of the medication. There are 5 tiers, and generally speaking, the higher the tier, the higher the copay. Once you've reached the max for Stage 2, you're going to move on to Stage 3, which is the coverage gap, sometimes referred to as the donut hole. This is the area where people get pretty confused and sometimes pretty upset, because during this time period, you go from paying a copay dependent upon the tier to a copay dependent upon the prescription's cost. You're going to be charged a percentage of the cost of the drug. Generally speaking, that's going to be higher than what you were paying in Stage 2. But luckily, there is a cap for Stage 3, and at that point you move on to Stage 4, which is catastrophic coverage. You'll still be charged a percentage, however, this percentage is capped at 5%, so your copays are going to be the lowest during this point. You're probably noticing a pattern here, which is that if you're eligible for Medicare Parts A and B, you're eligible for Medicare Part C and D. And the enrollment period for Medicare Part D is the same as with Medicare Part C. So that would be your individual open enrollment period, which is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. A special enrollment period if you qualify. And that annual enrollment period, which is every year, same time, and for Medicare Part C and D, it's October 15th through December 7th. One more thing that I do want to make note of. With Medicare Part D, if there are any gaps in your prescription coverage after you enroll in Original Medicare, you can be charged a late penalty, so please think ahead. Nobody wants to pay more money than they have to. I hope today's video has been helpful and has made you understand a little bit more about Medicare Parts A, B, C, and D. Now, of course, we didn't really discuss Medicare supplement plans today. Those would be some of the other letters like Plan F, Plan G. If you have any questions about that, you can check out our video on Medicare supplement plans or give us a call at 888-410-0344. Remember, at iHealthBrokers, we work for you, not the insurance company, and we do it at no charge. If you liked today's video, make sure to click like and subscribe. Also, if there are any other videos you'd like to see, let us know in the comments below or just say hi. Thank you so much for watching and have a great day. Bye-bye.